Lawsuit filed against a Syracuse dental clinic for allegedly performing unnecessary and at times painful treatment on children who were restrained is shedding light on an even greater problem for people who are on Medicaid.
There are only a small number of dentists here in central New York who will accept Medicaid payments, but there are a variety of reasons for this, and as Keith Copeland tells us tonight, all of those reasons add up to a lack of access for proper dental care.
Do it again, lift it up.
Over the past 2 nights, we've brought you the story of Central New York families who all allege mistreatment at this Small Smiles dental practice on South Geddes Street. But there is another similar thread that ties them together. All used Medicaid and all found lining up a dentist to be a difficult task.
There were basically very few. There was maybe 1 or 2 other places in the area, but it was like a 6-month waiting list.
There are precious few dental practices that accept Medicaid in central New York. The Wilson Dental on Salina Street is one that does. The owner says there are a variety of reasons why dentists don't, including a 40% no-show ratio for office appointments. But he says reimbursements that doctors receive is a big reason too. For instance, the average charge for a tooth extraction is $135. That's what most of us would be billed. Medicaid's reimbursement for that is $45. For a root canal, the average price can be as high as $925. Medicaid pays a little over $400. And for a crown that can cost more than $1,000, Medicaid will pay $493.
The resources and supports out there are really hard.
Linda Wright from the Salvation Army says many of the people they serve are in the same bind with few places to turn for proper dental care, even though Medicaid is at least able to provide some of the money for dental work.
Sometimes that's better than some of our private health insurances where dental care might not be a service from those. So that at least there is dental coverage there. It's trying to find the right place to go that'll take the public health insurance, the Medicaid, or the Child Health Plus. I think that's the challenge.
Now, another challenge, according to dentists, is that this lack of access to proper dental care ends up costing us all much more in the long run, as small problems that could be treated in a dentist office end up becoming bigger problems that require more medical attention and costing more money, too. Carrie?
All right, Keith, thank you. As Keith pointed out, there are limited options for low-income families to receive dental care, including the Syracuse Community Health Center. Their main office is at 819 Salina Street in downtown Syracuse.